Welcome back to the podcast. In this episode, I'm going to be talking about binge eating disorder, understanding the brain, the behavior, and the role of medications. We are talking about something that affects millions of people, yet it is deeply misunderstood, often hidden, and frequently wrapped in shame. If you ever felt out of control around food, eating far past comfort, eating in secret, and then feeling guilt or disgust afterwards, this episode is for you. And if you love someone who struggles this way, it is for you too. Binge eating disorder is not about willpower. It's not about being weak, and it's also not about lack of discipline. It is a real, diagnosable medical condition which is rooted in brain chemistry, emotional regulation, and learned coping patterns. Today, we are going to talk about what it is, why it happens, and how treatment, including a medication called Vyvanse, can help when used thoughtfully and appropriately with a clinician. Let me first explain what is binge eating disorder. Binge eating disorder is defined by recurrent episodes of eating a large amount of food while feeling a loss of control. People often describe it as, I feel like I cannot stop. I'm not even hungry, but I keep eating. I eat quickly. It's almost on autopilot. I feel embarrassed, so I hide it. Afterwards, I feel ashamed or disgusted with myself. For a diagnosis, these people happen to have these episodes at least once a week for 3 months, and for it should also cause significant emotional distress. One other important distinction, unlike bulimia, there is no purging, there is no vomiting or compensatory exercise afterwards. This matters because binge eating disorder is often dismissed as overeating, when in reality it is really driven by a loss of control and not a choice. Now, why does binge eating happen? Let's talk about the brain. Binge eating disorder is closely linked to dopamine dysregulation, the brain's reward system. It is also linked to impulse control challenges, emotional regulation difficulties, chronic dieting and restriction, stress, trauma, and perfectionism. Food becomes a fast, reliable way to numb uncomfortable emotions, soothe stress, feel temporary relief or even pleasure. When the cycle repeats over time, it becomes a psychological need to keep eating like that. Here's the catch. The relief is short-lived, and what follows, the guilt, the shame, the self-criticism, is what fuels the next binge. This creates a neurological loop, a pattern, not a moral failure. And this is why also therapy helps. The CBT is the first-line treatment for binge eating disorder. It helps people identify the triggers for binging, break all or nothing thinking when it comes to food, reduce rules around food and restriction, build alternative coping mechanisms. However, for many people, therapy alone is not enough, but it does help in combination with medications for that population. For moderate to severe binge eating disorder, you have to use some medication as an additional tool. The medications help quiet the binge urges. Let's talk about Vyvanse. It is the only FDA-approved medication right now for moderate to severe binge eating disorder in adults. Let me be very clear about what it is not. It is not a weight loss medication. It is not a cure. It is not appropriate for everyone. It needs to be monitored closely with the help of a clinician. The way it works is it affects the dopamine and norepinephrine system in the brain, the chemicals that are involved in focus, impulse control, and processing of rewards. So it helps with binge eating disorder by regulating these brain chemicals. You experience fewer binge episodes, reduced intensity of urges, less obsessive thoughts about food, improved sense of control. Once you start feeling that, again, it creates that new loop of how to be in control around food. Importantly, studies have shown that combining Vyvanse with cognitive behavioral therapy works better than either of them alone. Think of it like this. The therapy is going to teach very important skills and work on your thoughts. The medication quiets the noise so those skills can actually be used. The research, clinical studies consistently show that Vyvanse reduces the number of binge days per week, decreases compulsive thoughts around food, helps maintain remission when continued appropriately, and we see the highest success rate when medication, like I said, has been paired with structured therapy, not when it's used in isolation. Make sure to find a therapist who's trained in this specifically. Now, what are the side effects, safety, and cautions with use of Vyvanse? Vyvanse is a stimulant medication. It's an ADHD medication, so it does come with considerations. The common side effects include dry mouth, headache, insomnia. It can cause anxiety, decreased appetite, GI discomfort. Because it's a stimulant medication, there is also a potential for misuse, which is why careful screening of the patients is very essential. Dosing must be individualized. Ongoing monitoring is not negotiable, so regular follow-ups in the clinic is very important. Also, this medication is not appropriate for people with certain heart conditions, active substance abuse disorders, active mental illness, untreated anxiety or insomnia. This is why binge eating disorder should only be treated by clinicians who understand both eating disorders and neurobiology. And it's not a medication that can be casually prescribed or a condition that can be just casually treated. In closing, if this episode resonated with you, you're not alone and you're not broken. Help exists. Please talk to your doctor about this. Treatment also exists, and compassionate, evidence-based care can change everything. It can change how you feel. Please seek help. And if you know of a family member who's struggling with it, please seek help for them as well. If you have any questions or comments, please leave it on my website, weightandmetabolism.com. Thank you for listening.